Placement of a tourniquet. Direct pressure almost always controls bleeding. However, if bleeding is uncontrollable and life-threatening, where blood is rapidly soaking bandages or spurting or pooling on the ground, a tourniquet may save the person's life. This video will show how to place a tourniquet. Call for help. Use gloves and goggles to prevent exposure to blood. You can make a tourniquet from a strip of cloth, a short, strong stick, and the plastic ring from a water bottle. Place the plastic ring in the middle of the cloth. The ring is used to secure the tourniquet. A tourniquet is only used on an arm or leg. Place the tourniquet close to the wound and between the wound and the body. Never place one over a joint or over the wound itself. Lie the injured man down. Wrap the cloth strip around the limb. Tie 2 knots. Put the stick in the space between the knots. Turn the stick to tighten the cloth. Tighten with enough pressure to stop the bleeding. Warn the person this will be uncomfortable. Secure the stick within the plastic ring. Check that you do not feel a pulse. Then you know the bleeding is stopped. Write the time the tourniquet was placed on the person's skin. Here, we show how to place a tourniquet step by step. First, remove the plastic ring from the bottle. Open the strip of cloth. Then, pass the cloth through the plastic ring. Place it in the middle of the strip. Next, put the cloth around the arm. Tie 2 knots. Put the stick between the knots. Turn the stick to tighten. Then secure the stick within the ring. Check to be sure you do not feel a pulse and bleeding has stopped. You can also secure the stick with another strip of cloth. Tie a knot at the end of the stick. Bring the cloth around the limb several times. Then tie a second knot at the same end of the stick. Transport the patient immediately to a hospital with surgery. When you arrive, show and tell the person receiving the patient that a tourniquet is in place. It needs to be removed by a skilled provider as soon as it is safe. Remember, place a tourniquet only for life-threatening bleeding on an arm or leg. Use a wide band and tighten it until you do not feel a pulse. Then secure it in place.